We're in the middle of a youth mental health crisis. Plain and simple. Young people aren't getting the support and resources they need.
The reality is 80% of young people aren't receiving any mental health treatment.
Many young people have the desire to make change, but struggle to find inclusive spaces that center their voice for the future they want to help build. A future where they are not faced with inequitable and systemic barriers that hinder their education and health.
64% of young people report experiencing serious loneliness, and 20% admit to thoughts of suicide. Since 2003, we've been on a mission to change that.
Peer Health Exchange was founded by young people for young people to teach health workshops in public schools in order to fill the gap left by underfunded, understaffed district health programs.
Within a decade, we grew to 5 cities and beyond and reached over 200,000 young people, all thanks to listening and working with them.
Together, we laid out our strategy to focus on growth and scalability of our in-person, digital, and youth voice brands, and began the process of transforming Peer Health Exchange.
We do teach about stuff that needs to be talked about. It helps a lot of kids get to know themselves and know the resources that are available for them. It makes it like the norm, like, okay, this is okay to be talked about. I should be talking about this and I should be asking questions.
Since then, we've had some important wins, like pursuing new revenue opportunities inclusive of corporate partnerships, foundations, and government institutions, curating a vibrant and engaging rebrand across all 3 of our work pillars, expanding our youth advisory board to reflect young people across the country, and reaching over 650,000 young people with health education and resources through diversified digital and in-person program offerings.
Out of all the youth programs that I've done, PHE is one of my favorites, and I really just enjoy the fact that it's youth-centered. You let us take the lead on a whole lot of things.
My experience today has been really rewarding. I've had the chance to collaborate with fellow ambassadors and witness firsthand the positive change that occurs when young people are equipped with vital health knowledge.
Now, the current environment demands that we do more, and we must seize the moment. That's why we'll continue to scale and invest. We're excited to tap into unlocked potential across our organization, like innovating our in-person work through teacher-led programming in schools, as well as our peer-to-peer and affiliate models across Boston, Chicago, Cincinnati, and Denver, growing our community-based partnerships to deliver in-person health resources.
Peer-to-peer learning is basically in the name. We're peers. We pass each other in the halls and all that. We have classes together sometimes. They're learning health from somebody that's close in age to them. Like, okay, if they can talk about it and they can learn about it, maybe I can too.
We're well on our way to our goal of reaching 1 million young people by 2026.
We're reaching young people anytime, anywhere.
I ask for your generous support as we lean in to drive through these necessary changes so we can grow and carry out Peer Health Exchange's mission in service of all young people.
Now, more than ever, we must invest in youth health education to create a world where every young person has full access to a happy, healthy life.
Peer Health Exchange is building this future.
By, with, and for young people.